So what's up, guys? Welcome to this video. In this video I'm going to cover a majority of the questions that I constantly receive as far as gynecomastia information in general. Ever since I started making these gynecomastia videos, I've been getting the same questions over and over again, so I just figured it would be a good idea just to make one video where I answer every single question that I usually get and just get it out of the way, and that way people just can find this video and have their questions answered. So this is what this video is about. So without further ado, let's go ahead and get into it now. Right, so to begin with, let me just tell you guys what gynecomastia is, just in case there's somebody watching that doesn't know what that is. So you have two types of gynecomastia. You have pseudo-gynecomastia, which is basically fat, and you can get rid of that through working out and diet. It's just fat. Now, true gynecomastia is glandular tissue that will not go away no matter how hard you work out and no matter how many diets you try. It will not go away unless you get it surgically removed. Now, that is what this video is gonna basically answer questions about. Okay, so got that out of the way. So the doctor that I got my surgery done with, his name is Dr. Delgado. Miguel Delgado is his name. I had the surgery done in Novato, California. He has two places where he does his work at. It's either in the Novato, California area or the San Francisco, California area. So I'm going to have his information linked in the description box below, so that if you guys are interested in checking him out, you guys can feel free to do that, okay? So I always get asked, how did I go about finding my doctor? Research. Just, you have to actually do your research and not just go with the first doctor that you find. You have to find doctors and compare them. Compare their before and after pictures. You have to count how many patients they have had. So you need to find somebody that has the experience and has the knowledge to work on you, because this is a surgery that's going to be for basically the aesthetic purpose of it. So you don't want just somebody that just started doing this a month ago. You want somebody that has been doing this for years and knows what they're doing. So just go online and do hours and hours of research. You need to be careful about who you let do the surgery on you, because this is something big, okay? So research. I get this question asked so many times. Price. What did I pay for my surgery? The full amount for my surgery was $8,000, and that had to be paid up front. I had to pay that before I was able to get the surgery. Now, if you don't have the money to get this surgery done like right away, there's actually a financing option. So let me go ahead and get this paper out. So I was given this right here, Care Credit. So basically what this is, it's a credit card for medical purposes. So if you don't have the money as of now to get the surgery done, but you want to go through with the surgery, this is an option right here. Care Credit. It has all the information right here. It has what you would be paying monthly as far as the overall price and whatnot. So if you guys want to check this out, go ahead and go to www.carecredit.com. I'm also going to link this below, so if you guys want to check that out, feel free to do so. Another question that I get asked is whether I was under general anesthesia or just local anesthesia. And for me, it was done under general, just because my doctor doesn't do anything besides general. Okay, so that's also going to change the price, because general anesthesia is always more expensive than just local. So do your research and find out whether your doctor that you're looking into does both, or he just specializes in one thing. So that's going to change the price in the end, because general is always more expensive than local. So do your research for that also. Okay, so after surgery, you're leaving the hospital with a garment on. You're going to have some type of padding on your chest with a tight, snug garment on. Now, depending on your doctor, you might have drains and you may not. I had drains in, and I was told not to move or take off the garment until I had to go back into the hospital and get the drains removed. The discomfort of the garment is not, it's not horrible, but it's also not the best feeling ever. But it's something that you just have to learn how to deal with. Once you have your garment on, it's supposed to be snug. Not loose, not over tight, because it's going to cause complications. So just follow whatever your doctor tells you to do with the garment, because if you don't follow his directions like down to the last point, you're going to have complications, and in the end you're losing out because you paid for the surgery, and you're just going to have to just go through so much more trouble just because you didn't listen. So just listen to your doctor. No matter what he tells you to do, do it. Okay? As far as the garment, do it. Now, the visibility of the garment, it's not too bad. I would recommend wearing button-ups until you're comfortable, because, I mean, you can kind of see a little bit of the straps and a little bit of this right here. But it's not horrible. I mean, if you wear a like looser fitting clothes for a while, you're not going to be able to tell. So it's not super bad. It's not that bad. Now, eating. What can you eat after surgery? So I have a little list right here of what they gave me. I'll go ahead and read it to you guys. So, ideal recovery foods. You have crackers and pretzels. For the fruits, you have apples, bananas, melons, or other. And it also says that citrus may upset your stomach. For drinks, you have clear juices, which are apple or white grape, water, or 7-Up. You have applesauce, smoothies, vegetable juices, and avoid salty juices. For broth soups, you have chicken, beef, chicken with rice, and you have to choose low sodium if possible. Herbal teas and yogurt. So, I don't know if you guys can read that, but if you guys can see that, those are the ideal recovery foods. Now, what can your activities be like after surgery? What my doctor told me was basically just to pamper myself, have everybody else do everything for me. He literally just told me that. No matter how bad you want to move and do stuff, clean the house or this and that, don't do it. Just lay in bed and take it easy. This is going to be your time to relax and just milk this surgery out as much as you can. Just have your brothers or sisters or moms or cousins, I don't know who it is, but have them just basically do everything for you until you're able to move again, because you don't want to risk hurting yourself. If it feels like you're doing too much, you're doing too much. So just take it easy, and enjoy it. Enjoy your time off. All right, now scars. Let's talk about scars. So as far as scars, you will have the nipple area, and depending if you have drains or not, the armpit area. The scars are not visible whatsoever. A lot of people are scared of that. They think that after surgery, people are going to know that they had a surgery done and this and that, and it's not true. The surgery is barely visible. It's wherever the dark part of the nipple meets the actual skin of your chest, and you can't see it. Now, if you have drains coming out of your armpits, it's where the hair is at, so you're not going to see it. This is something that you should not be worried about at all. The scars are so tiny, they're like this big, and it's honestly not bad at all. So don't worry about the scars, they're tiny. Now, scar tissue is not the same thing as a scar. A scar is on the outside, and scar tissue is on the inside. So wherever your doctor does the surgery, usually you'll develop scar tissue, which is just basically this hard feeling to the skin underneath. So if that happens, then basically what your doctor just does, he goes in with a little injection and dissolves it. But most of the scar tissue just eventually goes away on its own. You can either massage it out or, just wait for it to come out. Or not come out, but like dissolve on its own. But it's not bad. Don't worry about it. It's going to feel hard, but it's totally normal. And your doctor might give you shots for it. He may not. So depending on what he wants to do. But I had shots given to me and it went away and now they're gone. So it's nothing to be worried about. Okay, so now I always get asked, when can I work out? When can I work out after surgery, and how hard can I go, right? Everybody's excited after the surgery they want to get into the best shape of their lives just because, you know, they have this new body and they want to show it off. My doctor told me 4 to 6 weeks. Now, knowing that kind of sucks because, I mean, that's a really long time. And a lot of people don't want to wait that long. And what happens if you work out before your body's ready, it's just going to cause problems. You're going to have internal bleeding, and it all goes downhill from that. So respect your doctor's orders and just wait on it. There's nothing much more that you can do besides eating clean. And that's what I try to do throughout my recovery process. And I would recommend working out before surgery, as far as like the months leading up to the surgery, just so that you can be in better shape and your body can be prepared better for the recovery process. And I mean, who wouldn't want to look better before and then not get super big during the recovery process, and then when they get out of it, they don't have as much to lose anymore, right? It makes sense. So just whatever your doctor tells you as far as working out waiting time, just respect it and ride it through. So after surgery, I mean, they go in there and they do a lot of stuff to your body, and it's going to be some tough stuff under there. So you're going to be swollen for a while. So basically what you can do is just grab ice packs and just place them on your chest. Make sure you wrap them up so it doesn't like get too cold and burn you. But ice packs help with the swelling. If the swelling goes down, then the pain also goes down. Now that brings me to another thing, pain. A lot of people ask me if the surgery hurts. Now, I mean, surgeries hurt. That's the thing. But this one, to be honest, I'm gonna be completely honest. From a 1 to 10, the entire process of this, I'm gonna say it was like a 4 out of 10. Honestly, to this day, I don't have 100% feeling in my nipple area just because it takes a while for everything to connect back, and basically you're under anesthesia for a really long time, and it's just, you don't feel pain. Think of the hardest workout you have ever done and multiply that by 4. That's basically the pain level you will be feeling after surgery. It's not super bad. It's something that you'll be able to live with. And honestly, would you rather feel a little pain for a little bit or have to deal with gynecomastia for the rest of your life? Think about that. It's worth it. Just relax, man up. Basically what I can tell you, right? Right. Now, as far as sensitivity goes, it's been a while since my surgery, and like I said, 100% not there yet. Takes time. It takes a lot of time for the nerves to connect back. So you're not going to feel your nipples for a while. So don't be freaked out if, you're touching your nipple and you don't feel it. I had my brother and my girlfriend touch my nipple while I was looking away, and I did not feel it, like, at all. I did not know that they were touching the nipple, and it's kind of freaky, especially when you look down and then you see somebody touching it and you don't feel it. It's kind of weird. Just remember that you're not going to have sensitivity for a while, and it's perfectly normal. Perfectly normal. Now, if you smoke, you cannot smoke for 14 days after. Luckily, I don't smoke, and if you do, you probably should stop because that's just nasty. But I'm not judging you. But you can't smoke 14 days after, okay? So, no smoking. Now, one thing that does suck, and I'm just going to be honest about this because that was probably the worst thing out of everything, was sleeping. Sleeping after surgery is just horrible. It's a nightmare. You have to sleep facing up, and you have to put like 30 pillows all around you just so that you don't move and hurt yourself at night. So just make sure that you have a lot of pillows prepared before so that when you come out of surgery, you don't have to be worried about that. So just basically the position that you sleep in, just pretend this is the bed right here. Facing up with your arms on top of pillows and elevated. You have to keep yourself elevated for a very long time, and it sucks. So sleeping facing up for a long time sucks. So that is that on sleeping. I get asked whether or not I would do anything different as far as the whole gynecomastia surgery. And to be honest, this is actually like, that was the best decision of my life, and I would not trade it for anything in the world. So I mean, if this is something that you really want to do, go ahead and do it. You know, don't let anything stop you. Don't let the price stop you. Money comes and goes, but I mean, you only have one body, right? So you wanna be happy with it. So don't worry about the money. Just go ahead and do it. Find a way to get it done. I'm not sure if I answered every single one of the questions that I get asked, but it's just like a basic overall answering of common questions that I basically get. And if you have any more questions that I didn't answer in this video, then you can go ahead and feel free to ask me, and I'll try to answer them as best as I can. Now, all of these answers are based off of my experience with my doctor. So if you have something else that doesn't, match what I said, then that's totally fine. Just if you have any questions, ask me. I'll be happy to answer them. I said earlier in the video, I'm going to have everything that I just talked about. If they have links or anything, any information that I can write down on the description box below, I'll do that. So that's going to conclude the end of this video. Thank you so much for watching. If you have any questions, feel free to ask. If not, you have yourself a great day.